Good morning, everybody. Welcome to Kidney Corner. I'm Dr. Dennis Mishler. I work in Indianapolis. I work in Indiana, and I work for the National Kidney Foundation of Indiana. And we're so glad you could be here with us today. Let me tell you a little bit about Kidney Corner, and there's the first slide. Nephrology. When I was a medical student, we called it the final frontier. But later on, I learned that that wasn't quite right. Transplantation was a better way to put it, the final destination, if you're lucky enough to be able to qualify for such a thing. The topic today is March is Kidney Month. And today we're here to discuss different issues, public health activities, and the impact of that health on us, Hoosiers. And our guest today, we're so fortunate to have Dr. Virginia Caine here with us today, the director of the Marion County Health Department. And we're also pleased to have Breaux, the state senator here from Indiana, to help us figure out all these policies and issues that affect us Hoosiers. So we're so glad they could be here, and we sure appreciate them giving us this time.
Thank you.
Now, oh, look. It's Billy the Kidney. My friend said you didn't exist, but there you are. You do exist, and you're here to help bring attention and remind us that on the beautiful June 15, I believe, on Saturday, we have the walk. Tell me which day it is if I said the wrong day.
June 11th.
June 11th. Oh my, it's terrible to get old. You know what that's like, right, Billy? But in case, these shirts are for us. So we need to get to Saturday, June 11th, for the kidney walk, Saturday morning. And we're going to walk for better kidney education, better kidney health, and better kidney function. That's right. Okay, thank you for coming by, Billy the Kidney. I hope these are extra large. Not for you. For me.
I'll take them.
All right.
That's right. Never tell a woman she's large.
Okay. I'm a doctor. I have more sense than that. Okay. We're running out of time already. Ad-libbing. Okay. So, Dr. Caine and Dr. Breaux, you're both very passionate about health of Indiana residents as you work in your fields and bring about positive change to fellow Hoosiers. And our episode is to discuss the items that relate to public health. And it looks like I'm a few slides behind. But here we go. So chronic kidney disease. Dr. Caine, can you begin by highlighting some of this data here that speaks to us about the public health picture in Marion County, in Indiana as Hoosiers, and the local initiatives that are happening to address these issues?
So first, let's just for the audience, let you know what is chronic kidney disease. You know, a lot of times the kidneys are one of the most important organs of your body, and it filters your blood to make sure it's trying to collect all the waste products your body builds or even fluid that you may collect. And so you've got something called a million filters in your body called nephrons, and they help filter your blood. But when they're damaged and they can't filter all these waste products and fluid, then what happens is you have what's called kidney failure. And about 10% of all U.S. adults have chronic kidney disease of different levels. Now, what's concerning for us in Marion County is that we're a 57% higher chronic kidney disease compared to the United States. We have a much higher death rate at 20 deaths per 100,000 populations, higher than the national average. As a result, we have so many hospitalizations related to chronic kidney disease. Our dialysis units, which can be used to treat these patients, they're off the charts in Marion County, and we still have an increased capacity that's needed in order to handle all of these diabetics. If I could have the... So, most important thing to remember, The two main causes of chronic kidney disease are diabetes and high blood pressure. They are responsible for up to 75% of all the cases of chronic kidney disease. And approximately 1 in every 3rd adult who's got diabetes will develop chronic kidney disease. 1 in 5 adults who have high blood pressure will develop chronic kidney disease. Next slide. But when we look at it from a breakdown, we're seeing nearly 115,000 patients starting new treatments every year for chronic kidney disease. Next slide. And if we realize it, you're more common if you're over the age of 70 years of age. But we have a higher rate in African Americans who are 3.5 times more likely to develop this kidney disease, and Hispanics who are 1.5 times more likely to develop chronic kidney disease than non-Hispanics. So what does that mean? We've got to tackle our hypertension, and we got to tackle diabetes. If we can do just those things, we can remove 2/3 of all chronic kidney disease in this country.
Thank you, Virginia. You really know your stuff.
I try to
And
know.
you are passionate.
So you know why I'm so passionate? I have a sister, I'm my only sister, who developed chronic kidney disease.
Wow.
And the frightening thing about the chronic kidney disease is a lot of times people have no symptoms. They're not aware that the damage is going on slowly. And it's not until you've almost lost the majority of your kidney function do you start to develop symptoms. And that's why it's so important. You gotta get your kidneys checked every year, annually. Even young children can get kidney disease. So make sure your doctors or your healthcare providers, whether it's physician assistant, nurse practitioner, or whoever, check your kidney function every year.
Senator Breaux, you just finished the 2016 Indiana legislative session. Could you highlight some of the health-related legislation that was passed?
Well, I think I can certainly do that, Dr. Mishler, and we did do some really good things. I'll just highlight a couple of them. One of them is the HIP 2.0 plan, which is the expansion of Medicaid, Obamacare. I'd say half of it was good and half of it I had some concerns about, but it didn't matter, it passed anyway. But what we did was codify into the state statute the provisions of the Obamacare plan. So it means that Indiana has at least committed itself to the continuation of providing expanded Medicaid coverage for individuals across the state. Now, the problem that I had with it, and many of my colleagues had with it, was that it codified a lot of the programs, such as the power accounts, and the power accounts have been deemed requiring some revision because it requires, and this is, the governor, and I thought I turned that off. I apologize. I apologize.
So,
This is live TV, right?
these politicians have these big words, but these politicians have these big words. Could you tell us what codified means?
Oh, I'm sorry.
Sorry, that's okay.
We actually put it into the state statute,
Okay.
Which means that we are now governed as a state to abide by what's in that statute. And what's in that statute says that we will continue to provide coverage to Medicaid patients. But what it also says is that the program will require those Medicaid patients to have some skin in the game, which is a big part of this program, which is concerning because it requires them to pay about $25, which it shouldn't be a big deal, but it shouldn't be a big deal. But for some folks, $25 is a barrier.
Is that $25 a month or
$25 a month?
Okay.
And that can be a barrier for some folks. And so to put that in state statute makes it, in order to change it, we have to go through the legislative process, which is, we've taken it out of the hands of the FSSA secretary, who could, by rulemaking authority, change that. Now we've said, because we've put it in statute, it's got to go through the legislative process, which makes it longer, tedious, and perhaps more controversial, which means it may not have any changes.
Gene, we have a problem. Our passion and our concern about chronic kidney disease Knee replacement therapy and transplant is so strong. We're running out of time already.
I see that, but that's,
I can't believe it. That says 0.
Hey, can I have one thing real quickly?
Yes.
You got to know the symptoms of chronic kidney disease. So if you've got nausea and vomiting, you're feeling your ankles are swelling, you got puffiness under your eyes, you've got this fatigue, you're so tired you don't know what to do, you may be having muscle cramps. Hey, and you've lost that appetite, think about chronic kidney disease for me.
And I've got one thing to say, and that is that we are very concerned about the high rate of Latinos who are developing end-stage kidney disease.
Yes.
And the lack of attention to providing them with some chronic
Chronic treatment, dialysis care.
And so we are aware of that problem, and we are working at it at the state level.
Well, thank you.
And those of you that are concerned about these legislative issues, go to the National Kidney Foundation of Indiana website. You'll see this advocacy center that you can fill out so that you're in touch. We can be in touch with you. So thank you, Dr. Virginia Caine and Doctor, you're a doctor now.
I love it.
Almost as good as being a senator. Senator Jean Breaux, thank you for being here, and we'll be right back.
Thank you.
You know, when Margaret and I decided to sell the old estate here, we had only one choice in signage. Logan Street signs and banners. Conveniently not located on Logan Street anymore, but rather located on 10th Street on the south side of Noblesville. Well, we sold the old beauty, and we were able to buy this wonderful estate. And we had so much money left over, I was able to buy this beautiful 1968 Eldorado Cadillac for Margaret. Only 472,000 miles. Margaret loves it because it's got those big seats and that heavy-duty suspension to support her svelte frame. Next time you're looking for signs or banners, call old Jim at Logan Street Signs and Banners, 773-7200. Conveniently not located on Logan Street anymore.
Good morning and hello again. We're back here at Kidney Corner. Last segment we found out we have a lot to talk about, and it's hard to get all the information to you that we need to. So we need to do this show more often, obviously. But
That's a longer show.
I think so.
a longer show.
I think
so.
so.
This segment, we welcome Nikki Howard with us, and Senator Jean Breaux is with us, and we're going to continue discussion about the initiatives for better public health. And I'll try to keep up on the slides and get them in a timely manner. But Nikki, you wanted to share us information about free, that's a good word, public education.
That's right. Yes, the National Kidney Foundation of Indiana has a free education program called Your Kidneys and You. And we offer this in the community to businesses, church groups, civic groups. And it's a nice presentation where we come and we explain the basics of the kidney function, what happens with kidney disease, and how people can protect their health. It's a series of PowerPoint slides. And then also some of the items that participants are going to learn when they come away from this presentation is what their kidneys do. A lot of people don't realize all that the kidneys do. They have a lot of jobs.
That's right.
Why they're important to your health. What is kidney disease? A lot of people don't know that. Who's at risk? I know Dr. Caine mentioned one group that's at risk. There's other groups as well. So we address that. Then some actions that people can take to protect their kidneys, and hopefully, if they have signs of initial kidney disease or risk factors, that they can take steps to reduce that risk. And also we're going to talk about two of the tests that are commonly done to check for kidney function. One of them is a urine test called the ACR, or the albumin to creatinine ratio, or the second one is a blood test, and it's a creatinine test which measures what they call the GFR. And I believe Dr. Mishler is going to talk a little bit about GFR a little bit later. But so if any businesses or anybody is interested in this program, please contact our office. We would love to do a presentation for you. We sometimes bring kidney patients with us, and we've gotten good reviews, so we would love to be able to help you out.
I teach medical students, and I have to pound in their heads on a daily basis. If you want to know how the kidney's doing, look at the urine, do a urinalysis. Seems easy, seems simple.
Seems
and
logical.
they're finally getting the word out that it's not so hard. But if you want to know some more about your risk of kidney disease, you can go to the site we had just previously, and this is the site. You just fill out your age and your race and whether you're male or female, smoking, that's always bad for you, and other various things. Just identify what's your risk and how do you figure out what you do about this risk. You see the doctor at least once a year, and that once a year visit should include a urinalysis. If you want to know how the kidney's doing, you have to look at the urine. All right, as Nikki mentioned previously, testing for GFR helps.
What is GFR?
Well, that's a good question, Jean.
Because I
you
know a
asked.
little bit about kidneys, and even I
We
don't
used to
know
call
what
it
that is.
creatinine clearance, how well the creatinine is cleared out of the blood into the urine, but we call it by the filter glomerular filtration rate. So we have a table that tells us what stage of chronic kidney disease or chronic kidney insufficiency you have. And most of the people, of course, that I see are down there in stage 4 and 5 with less filtration of the waste products out of their blood into the kidney. So if you're at 1 and 2 and don't have diabetes or untreated hypertension, that's not so relevant. But if you're at 3, 4, and 5 and had a chronic illness that eventually marches to dialysis or transplant, you want that march to be as slow as possible, or you want to halt that march. So that's why it's important. And every lab test that has chemistries on that include the creatinine will have the GFR to point out to people, hey, what are you doing about this? So to make it important. Nikki mentioned previously.
Well, you know, Dr. Mishler, we have a few extra minutes. Is it okay if I talk about another public health program that we have?
Yes, I want you to.
Okay.
Before I stumble over myself some more.
We do have another public health program. It's a screening program that we do, and it's called the Keep Healthy or the Indiana Kidney Check. It's very comprehensive. We again work with the community churches, businesses, and what we do is the participants go through different stations, and they'll have their blood pressure checked, their BMI, body mass index, they'll have their glucose checked, and their urine protein checked. So those things are all important to help us identify if someone might be at risk or even showing, you know, early signs of some kidney problems.
Now, let me just ask you, the BMI, the body mass index, that's really telling you how fat or overweight you are. So is obesity a contributing factor to
We never
to any
say
of
the
this?
word fat.
Well, obesity. That's right. You better not call me fat. But seriously though, people don't. BMI is the body mass index, which tells you how much excess.
And insurance
fat
companies
you have.
love to zero in on
But
BMI.
but is being overweight or obese, leaning towards obesity, is that a factor in kidney disease? Why is that important to know
Well,
what
the
your weight
problem
is?
is that usually the number one cause for diabetes type 2 is obesity, which can lead to kidney problems. And also there's certain types of kidney diseases that can be a bigger risk with obesity. But the main thing would be if I'm overweight, I'm at risk for diabetes, and diabetes is the number one cause of kidney insufficiency.
Right, I think that's
So
important
that's a
for
big
people to
deal.
know, because we don't think about the fact that that being overweight, we know being overweight is unhealthy in terms of just carrying around that weight, but it also is a contributing factor to kidney failure. and
Yeah, the
kidney
number one
disease.
cause of kidney failure, diabetes.
A little bit about the screening process. Why it's so important is because Kidney disease is silent, just like hypertension can be silent. I feel okay, but sometimes doing some tests find out that there might be something going on that you need to know about now so that 10 years from now you're not in big trouble and having to see the kidney doctor with chronic kidney disease stage 4 and 5. That's never a good appointment. So anyway, it's a great tool to find out how you're doing with things that are going on silently that you can't tell and not always seeing symptoms until it's in the later stages.
And then the other thing is once the participant goes through all the tests, they get to speak one-on-one with a doctor like Dr.
my
Mishler,
goodness.
who will go over all the results with them. And so you get quite a bit of services, free services at our screening. And in addition, if there are signs of the kidney issue going on, we will also do a finger stick and test your creatinine and the GFR. So it's very, very
It's a
comprehensive.
great time to be alive, the technology we have to get a test so quickly, right there on the spot.
Well, and I just want to emphasize that as a public policymaker, the amount of funds dedicated to public health are very minimal. And so prevention and catching things early and getting on top of things and not letting them devolve into illnesses is really the best approach. So anytime that you can get a test, anytime you can do any kind of screening, particularly if it's free, then as a public health professional, I would strongly encourage that because dollars, we just don't have the dollars to care for
And
illnesses.
thank you for your support of our program. Yes.
And preventing medicine, your message as a
Preventing.
legislator is preventing medicine is
That's right.
much, much cheaper
Absolutely.
than waiting until we have to start doing bigger and bigger and more expensive things.
And that's where we need to move our nation into paying more attention and allocating more resources to preventative care.
Okay, all you have to do is come out on Saturdays when we have these screening processes. It doesn't take long.
They can check our website.
A wealth of information for free.
Okay.
Thank you so much. We'll take another pause and be right back.
You know, when Margaret and I decided to sell the old estate here, we had only one choice in signage. Logan Street signs and banners. Conveniently not located on Logan Street anymore, but rather located on 10th Street on the south side of Noblesville. Well, we sold the old beauty, and we were able to buy this wonderful estate. And we had so much money left over, I was able to buy this beautiful 1968 Eldorado Cadillac for Margaret. Only 472,000 miles. Margaret loves it because it's got those big seats and that heavy-duty suspension to support her svelte frame. Next time you're looking for signs or banners, call old Jim at Logan Street Signs and Banners, 773-7200. Conveniently not located on Logan Street anymore.
Hi, welcome back to Kidney Corner. And of course, we want to wrap this up as March is Kidney Month. Wrap it up in a positive note. Humor. Humor is so important. It's so important in education, with my medical students. It's so important with my patients. When things are going well, we have a good time and we laugh because we know there's always the potential possibility that around the corner things may not be going well. So humor really is the best medicine. It stimulates the organs. It does all kinds of things to make us have a better feeling of well-being. Activities that relieve stress. Stress can be good in little low levels, but unrelenting stress, that's never good. So it helps our body do better, our heart do better, our blood pressure not be so high, and it soothes our tensions. Tensions that can get the best of us sooner or later. So we're going to do some cartoons here, but more about the long-term effects. I'll let you talk about the long-term effects, Nikki.
Okay. Well, as we all know, that laughter is good for all of us, and studies are showing that sometimes it can even improve the immune system. It generates some chemicals that help us fight stress and more serious illness. It can help ease pain. Many times chronic disease sufferers have some pain that goes along with their condition, so finding some humor, learning to laugh some, and of course improving the mood, because chronic disease again can kind of be hard and get people down. So it's good to find some humor in your day, try and laugh, and do the best you can with coping.
Even when the chips are down.
That's right.
And if there's time to take a walk or a bike ride, that helps.
So
All
we
right.
got our little cartoons.
Or go to the cartoons.
So we think some kidney patients might be able to relate to a few of these. So can you tell who that is there sitting in their chair, Dr.
Well, it
Mishler?
looks like Santa Claus.
It is, and he doesn't even catch a break, does he? Because what's his dialysis nurse
You
telling
should have
him?
home dialysis. Then you can do it 2 hours a day, every day.
She's saying, I don't care what day it is. 4 hours is 4 hours. So
this is an example of somebody that goes to a unit 3 times a week for 4 hours a session. It's like being on a plane. You can't get off for 4 hours.
that's right.
And you're stuck there, and without TV, you're going to be very angry. He doesn't have a TV there. That's why he's so angry.
And it doesn't matter what day it is. It doesn't matter.
Right.
It happens
Even if
regardless of the day.
And that's what she's saying. Even Santa Claus can't catch a break.
We will give him Christmas off. We'll give him Christmas off.
Again,
This is a cartoon. I don't know if this is funny or not, but when you're having kidney insufficiency, you have to restrict your diet because you don't have the kidney function to protect you from too higher levels of potassium. So this says, and let's see if the old bifocals can work, and this dish is
totally
potassium free.
And what's on the plate? Just about
Nothing.
So it
That's a nothing
shows
muffin.
the challenges of the diet for dialysis patients. I mean, it really is changing their eating habits to help protect their health.
And if you don't do a good job, you'll have the dietitian scolding you.
That's probably
In a good way, though, in a positive, supportive way, about how your potassium and your phosphorus look. Any case, next cartoon, I'm falling behind.
There you go. This one's for the transplant folks.
Hurry up with that kidney, Peterson. Obsessive compulsive disorder.
Compressive
Scrub nurses are never obsessive compulsive,
It's
I
a
must say.
compressive disorder because the kidney arrived in the bubble wrap.
Oh, excuse
And
me.
he's having fun popping the bubble wrap.
The irresistible urge to burst the bubble wrap. That is a strong urge.
We just hope that during someone's surgery that they don't get distracted with that.
We just hope they don't drop the kidney on the
But you
floor.
know, that would
never happen.
This just goes to
No, it wouldn't.
reemphasize how important
Very
attitude is
careful.
in the process, in the health recovery process. And when you have a chronic health disease, you have to have a very positive attitude, and you have to be able to look at some of these things like not being able to eat that pizza or all 5 pieces of those pizza. You have to reduce it back down to 2, keep your sodium levels out and so forth. So you know, this is really great because you have to find the humor in this.
Yeah.
Even though it's really not funny, you have to figure out how to find some humor in it to get through the day and keep your attitude positive.
Good point.
And it's easier to be a positive patient if your doctor is positive.
And I just
it's
think
easier
your
to be
body
a-
responds better to the positive energy, and you're less likely to get sick or to stay sick or to get infections and such.
The mental affects the physical.
It really does. It really does.
And it's easy to be a positive doctor if the patient is positive.
Absolutely.
And people ask, what are you so happy about? Because we have great times. We know good times in kidney disease when they're happening, and we celebrate because we know there's bad times that can be lurking around the corner.
Absolutely.
So we celebrate when we can, and when we can't celebrate, we gather up the troops and try to tackle the problems and do something about it.
I love
So
that,
there we
Dr.
go.
Mishler. That's perfect.
And there's Dr. Mishler, our next slides are going to show some other activities, some positive activities that people can join the Kidney Foundation doing, and you would meet other people It would be a good way to not feel alone in the world. You meet other folks, you have activities. So the first thing coming up is the Donate Life Transplant Games of America. It's going to be held in Cleveland, Ohio, June 10th through the 15th. Indiana will take a team there. We have for many years, and we've always had a lot of fun, done real well. We come away with medals. There's different events, swimming, ping pong, basketball. There's all different kind of events people can participate in. And so if you're interested, you can contact our office, and we can provide you with more information on that.
And there's nothing quite like meeting and greeting a post-transplant Olympic champion.
And some of the
Nothing like
participants are donors as well, so that's always nice.
That's true, and they're heroes too.
That's true, very true. Okay, another event we have that's always a lot of fun is our gala coming up, and that's going to be Saturday, October 15th at the Indiana Roof Ballroom. It's a fancy smancy type thing.
Can I ask if you're going to have those cute little puppies?
We probably will. Ooh. Yeah, we have some silent auction there and some live auction items, and we have had puppies there before that have found very good homes.
They're so cute.
Okay, so our last thing is our kidney walks. We have quite a few of those coming up. And
oh my goodness!
Oh, and look who's coming back
with his tennis
Oh,
shoes,
Billy is back
ready
now.
To get walking.
Yeah. Okay, Billy, you're going to be at some of our walks, leading our warm up, right? And cheering on the crowds. So these are the dates for our. We have one in Evansville, Mishawaka, Indianapolis, and Fort Wayne. To register, you go online there at kidneyindiana.org. Registration is free. We do encourage you to try and get together a team and have some fundraising to help support the cause. It's a beautiful time, and the one in Indianapolis will be at the Historical Society, and it's usually a fun time.
A beautiful day.
Yeah. So we hope everybody can join us with all these events.
All the people that have kidney disease, who maybe are on dialysis, who have received a transplant or donated a transplant, even families of people that unfortunately have passed away to kidney disease, they're so passionate they show up too.
Wow, yeah. Well, we've tried to share some public health things today, how people as individuals or groups can learn about kidney disease, so I think we've accomplished our mission. Thank you, guys.
This was very good. Thank you very much.
Thank you all for being here today. Thank you, Billy the Kidney,
thanks,
for coming.
Billy.
We'll see you at the walk.
Yay, Billy.
See you next month.
Thanks again, everybody.